Stormont-Vail has been known for more than a century for taking care of patients in Northeast Kansas. I think it's well understood that we provide quality care and are compassionate. I think it's less understood that the organization is so committed to innovation. And the Research Center is really an example of that innovative spirit. This organization has kind of wrapped its arms around the research process.
When you look at the mission of Stormont-Vail, it's to bring state-of-the-art, cutting-edge treatment and technology to the community hospital setting. And we're so dedicated to that mission because it brings to our patients exactly what our mission says: the best and the brightest applied in a community setting where we all work together to benefit the health of our community.
The key benefits from clinical trials being involved in a study are, number one, and I always tell patients this, an improvement, hopefully, in their condition. But then, too, the other big benefit is just benefiting science and medicine. We emphasize that the only reason they have any medicines right now, insulin or pills, is because other patients have already done studies ahead of them.
Research volunteers are really medical heroes. I marvel, and the staff often talks about, and research physicians talk about, the gift that they give, and it really is important and generous.
My niece at 15 months old was hospitalized and found out she did have RSV. After seeing what she went through, it touched my heart. I wanted to do something to help her and to help prevent that.
Research participants are motivated by a lot of things, and in often cases, and we hear this so frequently, it's not just about what they're doing for themselves. They care about what the information will mean to others in the future, and it's just a really important gift.
We had 2 stem cell transplants, and he was also on a different medication, and the cancer was coming back, so it was obvious to Dr. Einspar and us that it wasn't working. I mean, we had to change what we were doing, and he brought up trying this clinical trial. In the first month, it had killed 50% of the cancer that had come back. Before the trials, a person with multiple myeloma maybe lived 2 years, and that was their life expectancy. We're going to go on 3+, and we're just going to keep going, and it's because of this medication.
Well, I was diagnosed with mild Alzheimer's on August the 5th of 2013. And in some cases, I think I'm maintaining, and in some respects, I can recall some things of the past. That feels good to know that you have some things that you're hanging on to, and feel good about that and continue to forge ahead.
And of course, it's always helpful to be part of a clinical trials research because it can help people in the future. It gives us hope, and I think hope is an extremely important thing in life.
When you see people working together, even though you don't know what the future is, but you don't need to worry about the future. You make today our future and continue to move forward with that kind of an attitude.
When I first got ill in 2001, I didn't know what was wrong with me. They kept sending me to specialists after specialists, kind of ruling everything out. The last one was Cotton O'Neill with Dr. Walton, and he figured out that I had Crohn's. Went through a couple of different kinds of medications, and then the medication stopped working. I was sick again, and I was looking at all of my options and decided that the clinical trial seemed to be the best way to go. And then I started it in 2008. Once I started, the very first infusion that I had, I knew that it was working because instantly I felt better. So I have a much better quality of life now.
Somewhere around 10 years ago, I was at VA for an annual checkup. I'd been borderline for a number of years. I was pushing that 5.9. I did not know what 5.9 meant. But one day I went over 6, and Dr. Reddy says, "You just went over 6. You are a diabetic."
When you see a patient time and time again, like with Hal's visits, they were weekly for the first 3 months, you get to know that person quite well. You know what's going on in their life, you know what they're struggling with.
Getting together with Carmen, we just clicked. And I think she helped me more than anything to stay on a regimen, because we had goals to meet and get that diabetic problem down in control level. And that was our goal, is to reach this level. And I've maintained that now for a year.
It is nice to be a part of that, to feel like you have set some goals with someone and then worked through some of those struggles, because they're not easy. You can set a goal, but if you do not take those steps to get there, you're not going to get there. And I think, 99% of our patients will tell us that being in a research study, working with a coordinator, keeps them accountable.
I think it's important to thank Stormont-Vail for letting us do this. Clinical research takes a lot of talent and a lot of space and resources, and an organization has to be really committed to assigning some of those resources to clinical research. Their support has really been endless over the past 10 years.
I tip my hat to the people here in Topeka with this research protocol and having that available and working together. That too is hopeful.
At the end of the day, it's very, very rewarding with what we do here at Stormont-Vail in the research department and throughout the rest of the hospital as well. Our patients are brought state-of-the-art treatment in a community-based setting. They know their physicians, we know them, often on a first-name basis, and they trust us, which is why it's so important to us to understand the trials that we're doing and understand the medications or the new techniques and procedures that we're applying to healthcare here at Stormont.
Having that extra element and bag of assets or possible helps for patients in the field of clinical research, emerging therapies that hold some promise, it's that much more satisfying for me, for our staff, and for patients to have those options.
The volunteers over the past 10 years have made a difference to people in the future, to medical information, to science, and the rewards of those gifts we haven't even seen yet.
As they keep making progress in research, then, maybe we'll get to benefit from that. If not us, then somebody else will benefit from that.
While you might not be able to undo what has been, we have hope for today and tomorrow. And we are trying to instill that and hang on to that with ourselves, but also our family and other people, whoever we can help in this whole thing.
It's important to continue the studies to find, a cure or at least a remission. We've got to get to that stage because we just have too much to get done to be sick.